with an update. She'll be providing us with an update on our most recent STD data. I'm going to stop sharing and I will let Ava share her screen.
Hi, everyone. I turned my video off so that I would have an easier time managing my multiple screens. Thank you all for attending today, and please be assured that I really appreciate you taking the time out. I know you're very busy because I see all the data, so rates are up, as you well know. Okay, so all right. So as Linda said, my name is Ava Nepaul. I was formerly a disease intervention specialist supervisor starting back in 2017. Now taken on the role of being the STD surveillance coordinator. And today I just want to review with you basically the trends in data for chlamydia, gonorrhea, and syphilis. All right, so this is what I'll be covering this morning, and I don't think I will take 50 minutes to do it because I would like to allow some time for your questions and also comments from the expert panelists today who will be presenting. So I'll be going over, because I know that we do have some new people on the call today, and it's also a refresher for those of you who are not really familiar with the process of public health surveillance. And today I will be presenting not as many charts and graphs as has been previously done at these trainings, because I would like to focus a lot on talking to you today about the alarming trend in the rise of syphilis and congenital syphilis in particular. All right. So in Connecticut, the Commissioner of Public Health has powers granted to her by state statutes, and those are enshrined in what's called the Public Health Code. So clinical laboratories are required to report specific significant findings to the Department of Public Health, and they do this using a standardized format, the Form OL15C. Electronic lab reporting has been moving forward in our state with most of our, with all clinical labs. Hospital labs are still waiting to all be on board. And basically the reporting for that, I will be showing you a diagram to explain how some of that is going on. In addition to laboratories, healthcare providers and some other licensed professionals who are licensed by the Department of Public Health, including morticians, they are required to to submit information to the Department of Public Health on reportable diseases, emergency illnesses, and health conditions. For the reportable STDs, the form STD-23 is used. At present, we do not have electronic confidential case report capacity, but we are working on it. We also get information from other jurisdictions via a mechanism called the Interstate Communication Control Records. And this is important for you to know about because the information that we record at the Connecticut Department of Public Health. Sometimes we get people that are recently relocated to Connecticut. And when that occurs, say a state like Massachusetts may need some type of historic information on that person. In particular, as many of you know, with syphilis, it's very important to understand the titer history of individuals in order to determine whether or not they have been reinfected and need treatment. In this way, by communicating with other states securely, we are able to help people not be overtreated or undertreated. And in addition to sharing record search histories, we also get referrals from other states. So say a Connecticut resident went to Florida for a couple months, which has not been uncommon since the pandemic, and they were seen for STD testing in Florida. The laboratories would be required to send us that information, but the Florida clinician would not be required to report any significant findings. It would not be required to report any clinical information to Connecticut. Instead, they are required to report to the Florida Department of Health. So we would send an inquiry to the Florida Department of Public Health to try and get the clinical information we need in order to understand what's going on with that client. Okay, so this is just an overview of some of the things that I've talked about. You should see a little fishy. That is the EDX platform, what we call electronic data exchange. Basically information, and I'm missing a couple arrows, and I am aware that I couldn't get them to show up on our new slide template. But essentially, every piece of information we get, whether it be from a laboratory, whether it be a paper report that needs to get hand entered into a database, everything goes into what is called the Connecticut Electronic Disease Surveillance System, or CTEDS. And this allows us to systematically record the information that we're receiving. The information in CTEDS is used to inform our disease investigation and intervention activities. And specifically in Connecticut, we do follow up on syphilis cases, new infections with syphilis, congenital syphilis, and we are also responsible. The disease intervention specialists in our program are responsible for providing partner services to all newly diagnosed persons with HIV. Our disease investigation information, which consists of both categorical data and also qualitative information, such as a case narrative, a description of the social issues and challenges of the client. Those are all recorded in CTEDS as well. Using CTEDS, we are able to routinely report information to the Centers for Disease Control and Prevention. And the information that we collect and analyze does inform our educational materials and various other products, including our social marketing efforts. Now, I wanted to just briefly touch on surveillance case definitions for those of you who are not used to these kind of epi terms. So a case definition means that there are a standard set of criteria. So there are conditions that every single reported infection needs to meet in order for us to say that, yes, we agree that this is a case of chlamydia, gonorrhea, or syphilis. These case definitions are generated by the Council of State and Territorial Epidemiologists. They're adopted by the CDC for use in the National Notifiable Diseases Surveillance System, or NNDSS. And this basically allows public health epidemiologists across the nation to systematically collect, report, and compare standard data. Another thing you should know is that today I will be talking about case rates in some instances and also case counts. So a case rate basically allows comparison across time, and it allows us to use, we must use in order to calculate a case rate, which is usually expressed as number per 100,000 population. We use denominators generated by the US Census Bureau, and these are available to us annually. And by standardizing how we all calculate and present case rates, we really can do comparisons between national level data and our local level data, and between states. So now that I've told you about how we use standard case surveillance definitions, and that all states, jurisdictions, and what are called territories, such as Puerto Rico and the US Virgin Islands, CDC takes all of that information and produces statistical reports and tables. And in July of 2022, this is a screenshot of what of a CDC website, and you'll see that, you know, it's unusual to see CDC use colors like red on its webpage. So definitely there is a marked increase in STD cases nationwide, and in Connecticut we are part of, you know, we are experiencing the same type of situation. Okay, so I'm going to pause here and just open it up to for a couple minutes to kind of see which factors people think are contributing to, you know, the rise that we're seeing in sexually transmitted infections. What do you think is driving the increase? Okay, so age, interesting, and I don't care generation. Yes, Amina, definitely that is a factor. People having delayed access to healthcare or having more difficulty accessing healthcare due to housing instability, loss of income, and other factors that are related to the pandemic. Yep. Young people. Yeah, so the age groups 18 to 24 and 25 to 29. Decreased funding for prevention, stigma, people not being aware of their risks, and just in general of the risks with STDs. Oh, of course, Kim Adamansky. Yes. Kim has put in the chat that studies are conflicting, but there's a suggestion that PrEP may reduce condom use. I do not have more information on this, but it is a growing part of the literature. I can tell you that anecdotally, we have seen that there have been multiple reinfections, syphilis reinfections among men who have sex with men that we have noted in Connecticut. But there was also a situation too with people discontinuing PrEP during the pandemic due to their inability to access the care or financial hardship. And it has been mentioned, it was mentioned at our last Division of STD Prevention and Control Program meeting with Dr. Mena, the director of that division, that there is ongoing work on trying to understand why we are seeing those increases. We had that discussion several years ago about the U equals U campaign. And at the 2017 National STD Controllers meeting, there was a comment from, I think it was the NMAC, which I'm forgetting what the acronym means, but there was a comment made basically that the U equals U message should have been combined with a message about still using condoms, because PrEP only protects against HIV infection. Someone proposed that kids have too much free time. There are less activities that keep them active. Someone wrote in the chat that high school students are afraid to discuss this with their parents. And so they're having sex without being educated because they're trying to keep it secret. And someone also wrote something to the effect of no longer that the fear of living, the fear of having adverse outcomes from having HIV infection has diminished. I'm not really sure what the literature says about that, but I'm gonna thank you all for sharing your thoughts on this topic. With regard to the comment in the chat that someone made about high school kids, there are actually national data showing that teenagers are initiating, like they're experiencing sexual debut at a later age than in the previous decade. With changes to the availability of what we used to call sex ed in high schools, that could be a contributing factor to why we're still seeing very high infection rates in 15 to 19-year-olds. Okay. Did someone have a question? Did someone come off mute? Okay, I'm going to move on. Thank you very much, everyone. All right, so I'm going to talk a little bit about chlamydia. I'm going to talk a bit about the nationwide picture. From 2020 to 2021, there was a slight increase in reported cases. That increase was higher. It was higher among men versus among women. And interestingly, over the last decade, CDC reports that the rate among men has been increasing, increased 35% over the last decade, and it's been decreasing in women. From 2017 to 2021, rates continue to be highest among non-Hispanic, Black or African Americans, and also non-Hispanic American Indian Alaska Natives. This is a very colorful, a very colorful slide, but I just wanted to give you some perspective on how Connecticut is doing relative to not just the nation, but also the rest of the country, but also to our fellow New England states. So you can see that if we look at the orange, which represents 2018, we see a spike in 2019, and then in the pandemic year 2020, which is the last bar for each represented category, you'll see that there's a decrease. CDC has been very clear that the pandemic definitely affected not just people going for testing, but also reporting. If you consider in Connecticut that we were, like other states, recording information on people with on COVID tests, there really was a hit to our ability to assure that reporting was taking place. Or do you have something you had to work on, or? Okay. I'm sorry, could everyone just please mute? Thank you. All right. So you can see that our pandemic and our post-pandemic experience is not dissimilar to other New England states. All right, so between 2012 to 2021, ordinarily this graph goes all the way back to the year 2000, but I just wanted to keep it simpler so that you can wrap your head around what's going on here. These are the number of reported cases. And so the dotted line represents a linear trend. So that trend is consistent with the national trend that shows that, well, the number of chlamydia cases and therefore the chlamydia rates are increasing. Note the dip in 2020. Now you'll see that 2019 seemed to be a very big year, but I will just caution you that there have been some changes in how we select for what is a confirmed chlamydia case at the local level, at the state level. So I will be following up and investigating if I can clean up that 2019 number a bit, because it does seem a little bit out there. But definitely there was a dip in reporting in 2020. All right, so I put up a similar, very colorful slide regarding gonorrhea rates per 100,000 population, just to show you that gonorrhea actually took an interesting turn. If you look nationwide for the year 2020, case rates are up. So that's interesting, because while chlamydia appear to be decreasing, gonorrhea appears to be slightly increasing, and with concerns about multi-drug resistance, you should be aware, if you are not already, about the changes to the treatment of gonorrhea as recommended in the 2021 STI treatment guidelines. So it's disconcerting that gonorrhea is up, and while it has been increasing, mainly in populations of men who have sex with men, the information from 2021 in Connecticut suggests that women may be catching up. All right, so these are the number of reported cases of gonorrhea in Connecticut from 2012 to 2021. And again, a trend line showing that there is just a steady increase. Okay, I'm going to transition now to, I am biased, it's my favorite pathogen, T. pallidum. I've used this slide in many presentations, and I wish that there would be a new graphic generated by the CDC media group that I could use. But really, for what we have witnessed from 2020 to 2021, and what is still going on at a very marked pace for 2022 and now moving into 2023, is definitely, syphilis is definitely making a furious comeback. It is not letting up. So here's information on case rates per 100,000 population for 2016 to 2020. And I want you to see what's going on with Connecticut and Massachusetts. We have had some in 2022, we had some meetings with our Massachusetts colleagues to discuss this situation. And that's why the interstate confidential communication is so important, because there is a lot of movement between Connecticut and Massachusetts, a lot of movement between Hartford and the Springfield, Mass area. And definitely we have established closer working relationships with our colleagues there, because we really are seeing this, we really are seeing people seeking healthcare that's closest to them. And for some people that means, you know, even a drive up to Massachusetts from Hartford, that's a worthwhile enterprise for them. And I will say that Massachusetts, like Connecticut, is experiencing an increase in syphilis among pregnant women. And so, and many states are trying to beef up our activities with regard to addressing primary and secondary syphilis, rapid treatment of women who are of childbearing age or reproductive age. I'm showing you this, the rates per 100,000 population for regions of the United States. The American South and West are really, I mean, it's pretty devastating what is going on in places like Nevada and Mississippi. And we're talking not just live births, but, you know, a very large number of stillbirths that are occurring because of how we're seeing these rates go up and up and up. I presented information on the territories, and you have to understand the territory information is Puerto Rico, US Virgin Islands, American Samoa, and the Marshall Islands all combined. So the story is slightly muddled with that, but I can tell you that most of the data presented for territories is from Puerto Rico, which is important to those of us in Connecticut because we have such large, we have large enclaves of Puerto Ricans who move between Bridgeport, Hartford, and then also Puerto Rico, and travel back and forth frequently, especially since Hurricane Maria. All right, now this is a graphic that's straight from the Centers for Disease Control and Prevention. And I want to really focus on, I like this, I don't know if you can see my pointer, but do you see this crossover? I would think about this, my lesson from one of my neuroscience professors. Look at this decusation. Do you see this? So this is a very clear illustration of what we've been seeing in Connecticut, of how rates of primary and secondary syphilis are increasing among women, among heterosexual women. And if we look at the data in Connecticut from 2000 to 2021, I've presented here both primary and secondary case counts, and also early non-primary, non-secondary case counts. Early non-primary, non-secondary is what we used to call early latent syphilis, which means it's infection within the last 12 months, but it is not symptomatic. One of our presenters will be going over the intricacies of syphilis with you later. But this is super alarming, especially if you look at 2018 compared to 2021. And normally we just present on primary and secondary cases, but because early non-primary, non-secondary cases, you know, just because they don't have symptoms doesn't mean that they are not clinically relevant, especially when we think about pregnant women. And if we look at gender, while men still account for the majority of primary and secondary syphilis cases in Connecticut since the year 2000, this is not good. And the disease intervention specialists can also tell you that what is going on with our new syphilis cases in Connecticut, every single one of these cases, there's more and more complexity to running a field investigation for these cases, whether it be locating the client or having to help the client navigate the various challenges they have to accessing timely care. All right, so if someone is typing, could you please mute? Presenting here this information from the Centers for Disease Control and Prevention, which basically shows the relationship between the increase in syphilis among pregnant women and how that is related to or concomitant with the increase in congenital syphilis. Now, just a word on why all stages of syphilis are important when regarding pregnancy. In Connecticut, regardless of the stage, so if a person has syphilis of unknown duration or has latent syphilis, we are still following up to make sure that that mom has been adequately treated. Because and again, this is where the interstate communication comes into play, because OBGYNs may be monitoring titers. However, there are increasing issues with continuity of prenatal care. So we are trying to make sure in Connecticut to speak to all pregnant women, regardless of their stage of syphilis, so that we can emphasize the message to not get reinfected during their pregnancy and to keep their prenatal appointments so that their titers can be monitored. All right, so let's talk about congenital syphilis. All right. So another colorful graph, and we see once again the American South and the American West are getting hammered. And as I mentioned, the territories, most of that information is coming out of Puerto Rico. We do not have an updated, well, I haven't seen our updated infographic, but were able to calculate the just overall the percent of increases for chlamydia, gonorrhea, syphilis, and congenital syphilis in Connecticut. And hopefully we'll be able to release those a little bit later this quarter. Okay. So this is information that's straight from our surveillance activities in Connecticut. So I took a look at what our reported congenital syphilis cases were from 2012 to the start of December of 2022. So it looks like we are on our path to exceeding that threshold of 10 cases per year. And that means that we will have to do some more work on outreach, prevention, and bringing together a body of experts in order to do congenital syphilis case review and to really work on trying to prevent these situations from happening. To that end, we were successful in getting congenital syphilis added as a Category 1 reportable condition in the state of Connecticut, which means that a provider upon suspicion, upon recognition or strong suspicion, must contact the Department of Public Health within 12 hours. And actually, before I move off this slide, I'll just mention that I was informed yesterday that we may be up to 9 for 2022. The 2022 data will get finalized in the fall of 2023. All right, so what are the things that are common among our congenital syphilis cases? Sadly, sorry. Sadly, among our moms, a common situation is polysubstance use disorder. Particularly, we're seeing use of cocaine and opiates. Very little or no prenatal care at all before delivery, and difficulty with locating clients and getting them treated because of their housing instability and rapid movement. Some people do not have a fixed address and are engaging in what we call couch surfing, or they're living with relatives, or they go into rehabilitation for substance use disorder. Our challenges in Connecticut are not unique. The polysubstance abuse, lack of prenatal care, that's something that CDC has documented is occurring nationwide. In Connecticut specifically, our challenges include lack of provider familiarity with ordering diagnostic versus monitoring tests. And by that, I mean that there were instances where a provider ordered only a titer, and then because the titer was significant, however, the provider never went on to order a treponema test, or such as a TPPA or a FTA ABS, so that it was verified that it was syphilis. And that caused, even though the mom was going to her prenatal care visits, that basically caused her to not get treatment before delivery. We've also had some instances with delayed reporting of laboratory results. Recently, I was notified of a situation with a 3-month delay in notifying the ordering provider. And unfortunately, we're unable to get to that mom, and her due date was this month. So, and now we can't find that mom. And so it is unclear what's then going to happen, but the likelihood is that that child, if the child is not, if there's not a stillbirth or miscarriage, that child will have congenital syphilis symptoms. And that is not something that, any of us wants. Every congenital syphilis case is a manifestation of a series of missed opportunities. We've also had recurrent issues with no one at the birthing hospitals or infection control notifying the state. Even when a lot of these babies are born, they're in the NICU, the neonatal intensive care unit, for a very long time. If they're born premature, or if they have other issues, especially low birth weight. And so it's very disheartening to know that no one is really clear, or few people are very clear on what their responsibilities are to notify the state. I should mention too that most of the congenital syphilis infants born in Connecticut, successful live births, they are ending up in the custody of the Department of Children and Families due to maternal polysubstance use, which also then makes it difficult for us to get information on the outcomes of those children, like when they go to their follow-up pediatric visits, and to get information on any follow-up treatments or challenges that those children face. So in response to the increasing number of congenital syphilis cases in our state, we've been making a real effort, even though we have limited staff capacity to do it. We have been calling providers within 3 to 5 days of recognition based on our review of laboratory results. So we follow up, we call if the provider is an OBGYN or a certified nurse midwife. In Connecticut, we have established reproductive age is 15 to 49 years old. That differs from the CDC definition, which is 15 to 44 years old. And we increased it to 49 in recognition that in Connecticut, statistics show that delayed childbirth is a reality, and we do have a fair number of reports of syphilis testing coming from advanced reproductive services providers, so in vitro and surrogacy organizations. So we call to see, was the treponema test even ordered? And we document in CTEDS, our database, that, the TPPA was non-reactive or it was reactive. And using this method in 2022, we have detected 2 situations in which the provider had not ordered the treponema test. And in one of those instances, the person was pregnant. And so it was a good thing that we have this kind of active surveillance effort going on to ensure that we do not have anything that falls through the cracks. As I previously mentioned, congenital syphilis has been added to the list of Category 1 reportable diseases. And we're hoping that this will, that the presence of congenital syphilis on that Category 1 list will prompt providers to recognize that there really needs to be more active follow-up with persons who miss prenatal appointments. And if they can't locate the patient, that they need to, communicate with the Department of Public Health so that we can see if we can track that person down and make sure that they get adequate treatment. All right, so the last time I did a clinicians meeting, I called this take-home messages. I've rebranded it as take-to-clinic messages. So in Connecticut, chlamydia highest prevalence is still among persons aged 15 to 24 years old. More cases are still reported in females than in males, but it will take a few years. I think that we may see some differences emerging. Still, non-Hispanic whites are disproportionately affected compared to other groups. For gonorrhea, the prevalence is still highest in persons 15 to 24 years old. And non-Hispanic, Black, or African Americans are disproportionately affected. And the important consideration is with increasing antimicrobial resistance, it's even more important that providers adhere to the 2021 STI treatment guideline, the recommendations for treatment of gonorrhea. All right, so syphilis, big message, it's increasing among women of reproductive age. I would also like to mention that we are seeing an uptick in people age 60 and older with primary and secondary syphilis. So I just want to make sure that there is an awareness that across the life course, sex is a part of human behavior, and we cannot make assumptions about what is going on or not going on with people. So it's always important to take a sexual history. And with congenital syphilis, it's absolutely preventable. And speaking as a person who's worked in public health for a little over 2 decades now, it's actually quite, it kind of takes the wind out of your sails because we all try really so hard. It's absolutely preventable, and there's no reason that any child should suffer in that way. Also wanted to make sure everyone recognizes that the STI treatment guidelines are available as a mobile app, so you can have it right there at your fingertips. And I'll end with a slide, which CDC has not updated its cost analysis, but STDs are not just a social burden, but dollars and cents do matter. And if we can prevent these infections, there would be so many more resources available to address the social determinants of health and create a more equitable society, and to reduce and reduce health disparities in our country, in our state, and our country. I will mention too that while I haven't talked about HIV, you know, we are seeing that new cases in young men ages 18 to 24 are on the rise in Connecticut. And that is also a disturbing trend. So in your practice, again, making sure that you're creating a safe space for people, whatever their sexual practices are, to share with you the information that you need in order to properly counsel them, and a reminder that PrEP, the recommendations for PrEP have been updated to include anyone who is sexually active. And we do really need to increase the adoption of PrEP among heterosexual women of color, because there is a frightening trend of those persons contributing to new HIV infections in the nation. So with that, I will open it up for questions, comments.
So you could either unmute yourself or ask your question or comment in the chat box. So please feel free to do that if you have any questions. No questions for Ava? That was a great presentation, Ava. Thank you so much. And it's informative, but also very disturbing at the same time. Okay.